artery, press, and then I go down, it divides into several veins. This is a vein, top of the leg, common femoral vein. I'm just going to press down lightly. The vein collapses, the artery next to it is raining open, it's under high pressure. As I come behind the knee, this is called the popliteal vein. Just up here I can look at the vein going up the thigh, collapses nicely, the artery remains open.
Le 380 va encoder 4 turboréacteurs qui sont soit des Rolls-Royce, soit des engines Alliance.
The actual risks of DVT associated with air travel, and indeed any kind of long haul travel, the risk is very small. And yes, DVT has become synonymous with long distance travel, but it might interest you to know that you're 1,000 times more likely to get DVT after being in hospital, for example, for surgery or with an illness. So the actual risk of having a DVT after a long flight is only something like 1 in 5,000. And the risk of having a life-threatening blood clot or venous thromboembolism associated with long-haul travel is less than 1 in 2 million.
And the flow in it, which is shown at the bottom, changes as you're breathing and changes with the right heart, and that shows that there's no obstruction between point of measurement and the heart, so that's good. There's a few veins in the muscle here, just there.
If you are particularly at risk of DVT, for example, if you've had recent major surgery, or you've had a previous blood clot, or you have active cancer, then you might consider taking additional preventive measures. For example, the use of elastic compression stockings, which again should be of the right size and well fitted. In a very select group of patients who are identified to be at very high risk of blood clots, you can also, in addition to the stockings, consider and certainly discuss it with your GP, the use of an agent to thin the blood down before the flight. And the customary treatment would be a single injection of heparin, which is a drug that prevents blood clotting, prior to the flight in each direction.
In the other leg behind the knee, this vein is not compressing. Actually, there's a smaller vein near the surface which is compressing as I press down, which shows that's clear. But this one is held open by a large clot in the popliteal vein behind the knee.
Blah, 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 and point to here with your finger, etc.
The fingers or the mouse. And that's really quite a large clot for someone to have and poses a risk. So we would then refer this on to the haematologists for some therapy.
Clearly, pregnancy is a risk factor in itself, and travel would add to that risk. So, DVT would still be uncommon in that scenario in a pregnant woman flying, but you need to be aware of the risks and ensure that you take precautions to prevent DVT. And those precautions would be, clearly remain mobile, make sure that you're well hydrated, and certainly consider the use of compression stockings. People are often advised to take a tablet of aspirin before long-haul flights, but aspirin is really not very effective at preventing DVT, and in fact can cause more problems through the gastric irritation that a lot of patients might suffer.